indeed, how can we flatten the curve? A clinical pharmacist and chairman, Association of Hospital and Administrative Pharmacists of Nigeria, Dr. Titilayo Onedo, joins us on the program. Thank you for coming.
Thank you for having me.
Tell us what you think about the new normal for Nigeria as government eases the restrictions. How do you think Nigerians can manage to slow down the infection?
Okay, thank you. I would actually want to say the ease of the lockdown was actually brought about by the pressure of people on government. And it's just normal for us all to expect a spike in this, the spread of this infection. More so going by what we saw the very first day the lockdown was eased on Monday, we saw a lot of people, even though some were donning their face mask, but they were not taking other necessary precautions. They were not maintaining social distancing and so many other things that they did wrong. So definitely, we expect that the figures will increase. But, well, there's still a way forward. And one way forward I would want to suggest to the government is partnering with the community pharmacies. I think we cannot run away from partnering with the community pharmacies in the control of this.
What role can the pharmacists play in this fight?
Okay, for the community pharmacies now, they can help in infection prevention and control, whereby the spread that is already being witnessed now, because it's already in the community, and you know, these people are very close to the community. They are mostly the very first point of call for the people in the community. So government should train them in infection prevention control and should even empower them in testing using rapid diagnostic test kit, because we know already that it's like we don't have enough of this testing kit. So if we go using the rapid diagnostic test kit using the community pharmacy, I think it will go a long way in curbing the spread of this infection. More so, if this is not done early enough, the healthcare practitioners may be overwhelmed. And also, there may be some kind of challenges to the regular supplies of some medications used in the management of this COVID and PPEs.
What do you think about accreditation? Because the PTF has talked about that. They also mentioned hospitals who are not accredited to handle COVID-19 not to, that they need to be properly trained on how to do this. So perhaps approaching the government, has that been done? I mean, you're the chairperson for Lagos. What's the relationship with the Lagos State government with regards to the efforts on the pandemic?
Okay. On the accreditation, that's the way to go. They have to be accredited. They have to be trained. And I think the larger PSN body is still engaging the government on the way forward. But like I said earlier, we can't run away from it, because if care is not taken, we'll be overwhelmed.
All right, we'd like to thank you, clinical pharmacist, chairman, Association of Hospital and Administrative Pharmacists of Nigeria, Dr. Titilayo Onedo. Thank you for joining us on the program.
Thank you.